As any parent will tell you, children are not just mini adults. They are going through a lot of physical changes. And as a result, when we see them as physical therapists, we need to appreciate that. Now, I want to record this video because we are seeing young athletes, younger and younger, come in with injuries we typically didn't see till later on in their athletic careers, or maybe into even adulthood in some cases. And when we think about kids as they're growing, oftentimes they will have different types of injuries that maybe an adult wouldn't necessarily have, because different areas of their bodies might be more vulnerable. So I want to go through a few of what these types of injuries. Of course, there's more than what I'm about to name here. These are just some common ones, and hopefully there's some lessons we can take from it to maybe avoid such issues. So one example is, right, when we're growing, we have growth plates. Growth plates are just little lines of cartilage that are at the end of our long bones, like the femur and our thigh. And right over time, as we get older, that hardens, ossifies to blend in with the rest of the bone that we have there. But because it is cartilage in a kid, that area can be a place of vulnerability that could potentially give way that might not otherwise as an adult. We can get certain types of injuries as a result. Also, sometimes things grow at different rates. So one example of a condition that we see many times here at CHP is something called Osgood-Schlatters. Now, Osgood-Schlatters is a form of essentially a patellar tendinopathy, where we get a little bump on the underside of our kneecap, where the patellar tendon attaches onto the tibia, that shin bone, and when it pulls excessively at that attachment point where it attaches to the bone, we get a little bump. The bone itself becomes really sensitive, and then these young athletes can be really irritable when it comes to loading that knee, whether it's in jumping, squatting type movements, really a lot of athletic type maneuvers that involves a ton of knee flexion. And that can happen, right, because the bones are growing faster than that patellar tendon can keep up with. And so therefore it's pulling and yanking a lot at that site and causes irritation. Conditions like Osgood-Schlatters oftentimes get irritated during growth spurts. The same can be said for something called Sever's disease, which is very similar to Osgood-Schlatter, except the tendon involved is the Achilles tendon, and it attaches right at a growth plate. And oftentimes as we go through a growth spurt, perhaps, or we play a lot of sports involving a lot of sprinting and jumping, that Achilles tendon tugs excessively at that attachment point, causing irritation at the heel. And if you have a young athlete that has experienced that, it really slaps you in the face. It's pretty obvious when you have something like that, and the same can be said for Osgood-Schlatters. And then finally, another one is something called Little League's elbow. So we see tons of baseball players at Cohen Health Performance. It started initially with a lot of juniors, seniors in high school, some college athletes, and now we're getting athletes that haven't even gotten to high school yet with Little League elbow, which is caused by the stress of repetitively throwing overhead, leading to excessive pulling on the growth plate on the inside of the elbow, resulting in pain and eventually the inability to throw. Now, I would address all of these issues differently because they are all different conditions. But the best thing we can do for any of these issues is to see if we can prevent them in the first place, or if we've had something like this, let's make sure we reduce the incidence or the likelihood of having it happen again. The first step is, let's make sure we're monitoring the workload. This is especially true for the Little League elbow because we need to keep pitching volume and throwing volume within check, especially at a young age. It is something that is a big issue right now, but it also goes for the volume of play that we have in other sports as well. There are different rules of thumb that we can use for each. One of them, for example, is we want to limit the amount of practice/game time played each week to their age. So for example, if somebody's 12 years old, we want to keep the number of hours they are practicing and playing to less than 12 hours and so forth. And then another one is if we are having some symptoms or having any issues, especially at that young age, address it right away. The quicker we address it, the quicker it will go away. People at this age, they're very adaptable. They can recover incredibly quickly. So getting this addressed immediately will do a whole lot of good. And then finally, I've mentioned this in previous videos, play multiple sports. We don't want to specialize too early. If you're going to specialize, that's totally fine. Eventually, depending on the level you want to eventually play at, if it's into college and beyond, or you probably have to specialize as you get later into high school. But if you're not in high school yet, we probably shouldn't be specializing. Let's make sure we're playing multiple sports. If you're the parent of a young athlete that has pain or an injury such as what I mentioned today, or Anything else, contact us. We would love to figure out exactly what is going on and come up with a customized plan to be able to address it that applies directly to your child and the sports that they may play.